Hello everyone. Today let us complete anesthesia previous year's questions. Most common thermal disturbance in anesthesia is hypothermia. Inhalational anesthetic with highest nephrotoxicity, methoxyfluorine. Most definitive method to maintain airway, ET tube. Best way to maintain airway in cervical cord injury is intubation. Most common postoperative complication of intubation is sore throat. Inhalational anesthetics are made non-inflammable by addition of fluorine. Inhalational agent causing hyperglycemia. Desflurane greater than 6%. Inhalational agent for cardiac patient. Isoflurane. Laughing gas is nitrous oxide. Only complete anesthetic agent. Ether. Pin index of oxygen is 2 and 5. Needle used for epidural anesthesia is 2-year needle. Agent of choice for cerebral protection is thiopentane. IV agent of choice for daycare surgery is propofol. Inhalational agent of choice in shock patients is desflurane greater than 6%. IV agent causing maximum nausea and vomiting is etomidate. Agent of choice for preoperative sedation is midazolam. Drug of choice for shivering, pethidine. Most common used anesthetic technique is spinal anesthesia. Most common source of ICU infections is urinary catheterization. Last sensation lost during stages of anesthesia is hearing. Anesthetic agent with antiemetic property also, propofol. Fastest induction of anesthesia is caused by desflurane. Epidural is preferred over spinal because prolonged duration of effect. Spinal epidural abscess is most commonly caused by staphylococcus. Local anesthetics act mainly by inhibition of sodium channels. First priority in management of trauma patient is airway. Mechanism of action of local anesthetic is stabilization of membrane. Bupivacaine is used for spinal anesthesia in concentration of 0.5%. Percentage of xylocaine used in spinal anesthesia is 5%. Shortest acting local anesthesia is chloroprocaine. Fastest route of absorption of local anesthetic is tracheal. Early and reliable indication of air embolism during anesthesia can be obtained by continuous monitoring of end tidal CO2. Salix manure is used to prevent aspiration of gastric content. Nasal intubation is contraindicated in CSF rhinorrhea. Mendelssohn syndrome, aspiration of gastric contents. Pulse oximetry detects inaccurately in presence of nail polish, methemoglobinemia, skin pigmentation. Mallampati grading is for inspection of oral cavity before intubation. Mallampati criteria used for assessment of difficulty in intubation. Anesthetic agent associated with delirium and hallucination is ketamine. Intraocular pressure will be increased by ketamine. IV agent with best analgesic agent, ketamine. IV agent of choice for shock is ketamine. IV agent of choice for full stomach is ketamine. IV agent of choice for uncontrolled asthmatics is ketamine. Dissociative anesthesia is produced by ketamine. Raised ICT is caused by ketamine. Dose of ketamine 2 mg per kg per IV. Muscle pain after anesthesia is caused by suxmethonium. Muscle relaxant increasing intracranial pressure is suxmethonium. Muscle soreness post anesthetic is caused by suxmethonium. Preloading is no more recommended to prevent hypotension during spinal anesthesia. Hepatotoxic agent is halothane. Color of oxygen cylinder is black and white. Anesthesia of choice for manual removal of placenta is general anesthesia. Anesthesia of choice for alcoholic liver failure is sevoflurane. Anesthesia of choice in renal disease is atracurium and cis-atracurium. Best anesthesia in status asthmaticus is ketamine. In belladonna poisoning, antidote is physostigmine. Atropine is used in mushroom poisoning or malathion poisoning or OP poisoning. Longest acting local anesthetic agent is Dibucaine. Pudendal nerve block involves S2, S3 and S4. Pneumothorax is a complication of brachial plexus block. Post-anesthetic emesis is least common with propofol. Cardiac stabilizing anesthetic agent is etomidate. Ketamine is contraindicated in glaucoma. Cardiostable anesthetic is etomidate. Ketamine is used as anesthetic in cyanotic heart disease, right to left shunt. Shortest acting muscle relaxant, succinylcholine. Bradycardia is common after injection of succinylcholine. Neuromuscular blocking agent with shortest onset of action is succinylcholine. Malignant hyperthermia is most commonly precipitated by succinylcholine. Hoffman's elimination is seen with atracurium. Shortest acting IV analgesic is ramifentanil. Muscle rigidity is caused by fentanyl. Method of choice for induction in children is by IV. For high pressure storage of compressed gases, cylinders are made up of molybdenum steel. Anesthetic agent safe to use in increased intracranial pressure is thiopentum. In a patient with multiple injuries, first thing to be done is patency of airway. In spinal anesthesia, which fiber is lost first? Sympathetic. Drug with sealing effect is buprenorphine. Least soluble anesthetic agent is desflurane. Inhalational induction agent of choice in children is sevoflurane. Post-spinal headache is due to CSF leak. Bone marrow depression is seen with nitrous oxide. Halothane causes bronchodilation and hepatitis. In high spinal anesthesia, hypotension and bradycardia. Spinal anesthesia should be injected into the space between L3 and L4. In a trauma patient, grey color of cannula will resident use to obtain maximum flow rate. Best position to insert Ryle's tube is sitting with neck flexion. Murphy's eye is seen in endotracheal tube. Modified Malampati grading is used in assessment of difficult airway. Most effective circuit in spontaneous anesthesia in adults is Mapleson A. Nerve to be used for monitoring anesthesia is ulnar nerve. Malignant hyperthermia susceptible individuals have skeletal muscle receptors. Abnormalities most often in the rhinodean receptor RYR1, which allow excessive intracellular calcium to accumulate in response to triggering agents. Succinylcholine is the most common cause of malignant hyperthermia. Among anesthetics, halothane is the most common cause of malignant hyperthermia. The most reliable sign of malignant hyperthermia is unexplained hypercapnia, that is increased end tidal carbon dioxide that is resistant to increasing the patient's minute ventilation. The initial dose of dantrolene for malignant hyperthermia is 2.5 mg per kg IV to be given rapidly, after which EtCO2 typically normalizes within minutes. Current guidelines recommends continuous waveforms capnography besides clinical assessment as the most reliable method of confirming and monitoring the correct placement of an ET tube. Clinical signs of correct ET tube placement include an adequate chest wall movements, confirmation of position by direct laryngoscopy, observation of ET tube passage through the vocal cords, presence of breath sounds in the axilla and absence of breath sounds in the epigastrium, and condensation in the ET tube during ventilation. Cardiac toxicity associated with overdose of intravascular injection of local anesthetic is characterized by hypotension, atrioventricular conduction delay, idioventricular rhythms, and eventual cardiovascular collapse. Although all local anesthetics potentially shorten the myocardial refractory period, Bupivacaine avidly blocks the cardiac sodium channels, thereby making it most likely to precipitate malignant arrhythmias. The mechanism by which lipids reverse local anesthetic cardiotoxicity is by increasing clearance from cardiac tissue, also known as lipid sink, as well as inhibition of myocardial fatty acid oxidation, thereby enabling energy production and reversing cardiac depression. In the setting of a possible cervical spine injury, the jaw thrust maneuver, in which the neck is held in a neutral position, is preferred over the head tilt chin lift maneuver. High flow nasal cannula therapy is an oxygen supply system capable of delivering up to 100% humidified and heated oxygen at a flow rate of up to 60 liters per minute. The internal diameter of the cuffs is printed on the side of the ET tube. In adults, the best place to check for a pulse is the carotid artery. In children, the brachial and femoral arteries are first choices. Epinephrine 1:2 lakhs or 5 microgram per ml may be added to local anesthetic solution to produce vasoconstriction so as to limit systemic absorption and the systemic side effects. The extent to which epinephrine prolongs the duration of anesthesia depends on the specific local anesthetic used and the site of injection. Cisatracurium does not cause increase in histamine secretion, does not affect heart rate or blood pressure, nor does it produce autonomic effects unlike atracurium and is thus preferred. Cisatracurium is 4 times as potent as atracurium and produces less laudocin. Atracurium triggers dose-dependent histamine release that becomes significant at dose above 5 mg per kg. Venturi mask is a type of HAFOE mask, that is, high airflow oxygen enrichment devices, is used to deliver a controlled oxygen concentration to a patient. Nasal cannula is used to avoid increase in dead space when a low flow of oxygen is indicated. Non-rebreathing mask has a one-way valve, prevents the exhaled air from entering the reservoir bag, and provides the patient with enriched oxygen during inhalations. Nasal masks are effective interfaces for non-invasive positive pressure ventilation in most pediatric patients since they allow better removal of CO2. The oximeter is a key component of a WHO's 19-point surgical safety checklist, which substantially lowers deaths and complications from surgery. In the injectable form, maximum dose of lignocaine, which can be given alone, is 4.5 mg per kg. The oximeter is a key component of WHO's 19-point surgical safety checklist, which substantially lowers deaths and complications from surgery. In the injectable form, maximum dose of lignocaine, which can be given alone, is 4.5 mg per kg. When combined with epinephrine 1:2 lakh, maximum dose which can be used is 7 mg per kg. Onset of anesthesia is faster with IV injection than with inhalation, taking about 10 to 20 seconds to induce total unconsciousness, avoiding the excitatory phase of anesthesia and thus reduces complications related to induction of anesthesia. Exhausted soda lime or defective valves of closed circuit will show high EtCO2 values. In a pregnant female, there is decreased requirement of the spinal anesthetic agent because of decreased volume of subarachnoid space, engorgement of epidural veins, and increased sensitivity of the nerves to anesthetic agent, but not due to exaggerated lumbar lordosis. Ketamine should be avoided in patients with history of seizures as it further increases ICP and also causes delirium and hallucinations. Succinylcholine has a shelf life of around 18 months, generally stored at 2 to 4 degrees Celsius and can be stored up to 2 years. Phenylephrine is the vasopressor of choice to restore coronary perfusion in patients with severe aortic stenosis when under general anesthesia. Manual ventilation before intubation is to be avoided as this inflates the stomach and encourages regurgitation and aspiration. Due to unique metabolism independent of hepatic and renal functions as well as quick degradation, atracurium and cisatracurium are preferred in patients with high serum bilirubin or high serum creatinine levels. Glycopyrrolate is Most commonly used antisecretory as a part of pre-anesthetic medication. Ketamine is the preferred agent in cases of acute shock, stimulates sympathetic system causing tachycardia and hypertension. While performing epidural, a snap is felt just before entering into the epidural space due to piercing of ligamentum flavum. Though pulmonary artery is most accurate site for core temperature measurement, esophagus has similar reliability and is the most commonly used site in the anesthetic practice for temperature monitoring. The color of medical oxygen cylinder is a black body with white shoulder. The blood gas partition coefficient is the main factor that determines the rate of the induction and recovery of an inhalational anesthetic, and the lower the blood gas partition coefficient, the faster is induction and recovery. Second gas effect. Because nitrous oxide is not soluble in blood, its rapid absorption from alveoli causes an abrupt rise in the alveolar concentration of the other inhalation anesthetic, leading to faster induction. Caesarean sections require sensory blockade up to the T4 dermatome level, as this not only blocks the somatic sensation of the caesarean section but also eliminates the visceral pain from peritoneal manipulation. Thank you.